In a PRP treatment, what is the main difference between the clinics or doctor? Is the technique or technology different? I noticed there are different prices to the treatment. In hair transplant, I understand there are different methods, different circumstances. But what is different in PRP injections? I also wanted to ask if it matters if the doctor is a skin specialist or if he is a specialist in aesthetics.
Thank you for your question. You submitted your question without a photo, and you're essentially asking why is there such a wide difference in PRP treatments for hair loss. You seem to feel that you can understand what the difference is when it comes to hair transplant surgery, but you're trying to get a sense of why there's such a wide difference and who is most qualified. Well, I can certainly share with you a little bit of understanding based on my own practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of Tricostem Hair Regeneration Centers, a system we developed starting about 7 or 8 years ago, using PRP and extracellular matrix to help men and women with male and female pattern hair loss non-surgically. And this was derived from hair transplant surgery. And so I can certainly speak to you from the perspective of a pioneer, of somebody who has been an innovator and ultimately developed a system that has been very successful. So to give you a certain sense of how I ultimately first derived this treatment and then how I tried to arrive at cost that can be reasonable. So to begin with, we were doing a lot of hair transplants. I'm a cosmetic surgeon and I've been doing hair transplants for many years. And when you do hair transplants, you have two major concerns. One was to have the healing of the donor area be as good as possible, and two is, of course, to get the grafts to grow and to heal as well as possible. There's a certain loss of graft viability in any hair transplant. And so we use this material called extracellular matrix with PRP. Well, a very pleasant side effect was thinning hair became thicker, and in a lot of our patients. And so I basically asked the question, can we take this effect and reproduce it with consistency? And so we started looking at different formulations and treatments, and we followed our patients very closely. We're seeing them every 3 months, and we were seeing them for years. Well, to make a long story short, we ultimately developed an algorithm, a system of customization of concentrations and methods of delivery to maximize the growth of hair non-surgically. Now, in addition, with all of this experience over all these years, I also developed a classification system. And I've developed a classification system to help our patients have a sense of prognosis, to expectations to what they can see with our treatment. Now, the classification system is based on gender, age of onset of hair loss, rate of progression, degree of progression, and other medical variables, including previous surgeries, previous injections, previous treatments, as well as hormonal and other levels. Now, when it comes to cost, I think it's very important whenever I do a consultation with a patient at this point. We treat so many patients from around the world. We've reached a point where I'm actually being very selective on who I treat, because it can really take up a lot of your practice's resources, like in a practice like mine where I do cosmetic surgery, I do cosmetic eyelid surgery, I do facelifting surgery, I do lasers, and I do injectables. And in addition, developing this hair loss treatment has been so successful that we actually have developed additional offices, and we're trying to scale in a way that is consistent and predictable, and that continues to be something that we are working on. So I would say that one of the things that I've had to look at in terms of this treatment, in terms of cost, has been it's not just the cost of a procedure, but rather when we developed our costs, we looked at the overall management of the individual patient. And I think it's very important for you to select a doctor who you feel comfortable with, who is going to look at your situation from a hair loss management perspective. What does that mean? Well, a lot of my colleagues will just do an injection and then that's it. When we see our patients, our consultations take a long time. We spend at least 30 minutes or more taking standardized digital photography, microscope photos, and getting extensive medical history and doing an examination and having an extensive discussion and ultimately developing a treatment plan. With that treatment plan, typically there is at least 1 to maybe 2 injection treatments separated by anywhere from 15 to 24 months. And in between, we see our patients every 3 to 6 months. And all of that is under one cost. So you can imagine with every follow-up, we're also taking photos and doing microscope photos, and we're looking and reviewing results. We're basically being accountable to every patient for their treatment strategy, and we work hard to make sure that we can get a successful outcome or have a high probability of a successful outcome. And there are no guarantees in medicine, but with all this experience, we have ultimately developed a system. And that system means that also there are other things that can be done in conjunction with hair regeneration to maximize hair growth for as long as possible. Remember, hair loss is hardwired in the DNA, and what we're doing is manipulating different pathways to prolong the lifespan of the hair as well as to ultimately maximize coverage for as long as possible. So the cost differential is how, or I should say the cost for our treatment, this is how I arrived at it. Now I would certainly say that you have to look at the level of follow-up as an important part of your decision. And when doctors try to do procedures in a more of a transactional way, very often they're just saying, come get an injection, we'll see what happens. I have seen other doctors' photos and patients coming in with photos, and I'm amazed at how inconsistent these photos are and how often patients don't get photos taken and how things are done kind of half-heartedly, and ultimately they're paying for just seeing if something works. So it's really important. Don't be fooled by one claim of better PRP compared to another. Look at the individual doctor's real personal experience. Look at their before and after pictures. Look at how long they've been doing their treatment. Look at how confident they are with their treatment. Therein lies the value. It's in the expertise. It's in the experience. It's in the accountability. It's in the longevity of the commitment to your individual treatment and how many times you'll be seen and the availability of that doctor. You know, our patients have very good relationships with us. They'll call our office and either I or my technicians will always return their phone calls. So it's important to think about those variables instead of just thinking that one person's PRP is better than someone else's. That's just mostly nonsense. It really is about experience, expertise, and what I just mentioned. So I think you have to look at it from that perspective. Again, remember, hair loss is management, and you just don't take a shotgun approach. And I think that a lot of doctors are offering what is essentially a shotgun approach and trying to see if it works or if it doesn't, and not having that level of commitment in their practice to managing patients with hair loss. So I hope that was helpful. I wish you the best of luck. Thank you for your question.